Hi there, my name is Taylor and I'm a nursing student at ASU Circe. Today is Wednesday, June 24th, 2020, and today I'll be performing a Foley catheter insertion on a female patient. Now, 3 reasons that a female might need a Foley catheter is urinary retention, if they were found to be holding urine because they hadn't voided for a while and on assessment and bladder scanning they were retaining, we might give them a Foley catheter per a physician's order to help prevent a UTI. If they were headed into surgery and we wanted to avoid unnecessary contamination in the operative room, or if we needed a stat specimen and the patient was unable to avoid, we could do an in and out catheter to obtain the specimen that we need. Now, when I enter my patient's room, the first thing that I would do was hand hygiene, and I would assist my patient to laying down flat, would help them. They ask them to raise their knees, and I would raise the bed up to a working height for me. I would then, ensuring that the curtain was closed, the door was closed, and we had the privacy we needed, uncover the blanket for my patient and raise the end of their gown. Next, I would assess if they had any allergies to iodine or latex, keeping in mind that some patients may know that they're allergic to shellfish, but not know that they're allergic to iodine. So it's important to ask about shellfish as well, because that is the same allergy. Next, I'm going to open my kit. I'm going to place my kit here. All right, I'm going to remove my sterile gloves. Be careful not to touch anything. And a second here. I will take my sterile drape, ensuring that I touch only the edge, touching only the edges, taking the shiny side and placing it down on the bed in front of the patient, touching only the edges. Next, I'm going to don my sterile gloves. This is still sterile. And I can touch my gloves because this hand is sterile. And still touching on the outside of my glove, making sure it's on correctly. I can take this, drop it in the trash, keeping my hands above my waist. Now, if this was a regular patient, I would take this drape and I would drape it over their thighs and abdomen, exposing only the perineum. However, because of the position of this mannequin, I cannot do that. So I will dispose of this. So next, I'm going to prepare all of my equipment. To pull this out. This is also sterile. Go ahead and open this. I'm going to attach this to here. So when it comes time to do that, I can just do it easily. All of the things that I'm touching are still sterile. All right, now with my non-dominant hand, I'm going to spread my patient's labia. I'm going to take my iodine swab since they do not have an iodine allergy. And I'm going to do one swipe on the area farthest from me. I'm going to dispose of it. One swipe closest to me, dispose of it. And one swipe straight down the middle, and dispose of it, making sure I'm always going from clean to dirty. Next, I'm going to sterile as well. Want to grasp a few inches up and taking this, cover it in the lubricating jelly. I'm going to ask my patient to bear down as I insert this. You're going to feel some pressure, but it shouldn't be painful. And I will insert it into the urethra. All right, I see urine outflow, so I know I'm in the bladder, and I will insert another inch or two. And then I will secure, reach down, and inflate my balloon. After inflating my balloon, I will let go and give it a tug. And I know that I'm in the bladder because it tugged well and everything's good. And then I'm going to gather up all my supplies and dispose of them. I'll put this, all this in the trash. Now, if this was a regular patient, I would have a stat lock that I would apply to the patient's thigh to ensure that they the Foley was not pulled out by anything, but because I don't, I'll just tell you that that's what I would do. So next I would take off my sterile gloves, don some clean gloves. I'm going to wipe the excess off of my patient. Throw that away. And I'm going to hang this below my patient's bladder, which it is, so that I know that it drains well. Then I would take off my gloves, cover my patient back up, put the blanket back on top of them, return them to a comfortable position, make sure the bed is returned to a low lock position, ask them if there was anything else I could get them, do hand hygiene before I leave the room, and when I leave the room, I will document that I inserted the Foley, what kind of Foley I inserted, how they tolerated it, how much urine return I saw immediately, and the color and characteristics of that urine. Thank you.